If you're over 60 and you're taking amlodipine, losartan, or lisinopril for blood pressure, I want you to stop for just a moment and think about something. Do you know exactly what your medication is doing inside your body? You may take your pill every morning. You may check your blood pressure and see a number you like. And you may assume that all blood pressure medications basically do the same thing. But they don't. Amlodipine, losartan, and lisinopril can all lower blood pressure, but they work in very different ways, and those differences can matter, especially as you get older. One can cause swelling around the ankles. Another can affect potassium levels and kidney function. Another can cause a persistent dry cough. And sometimes, a medication that works extremely well for one person may not be the best fit for another. Now, I'm not telling you to stop taking your medication. Please don't do that. If you've been prescribed amlodipine, losartan, or lisinopril, take it exactly as directed, unless your doctor or pharmacist tells you otherwise. What I want to do today is help you understand what may be happening inside your body when you take these medications, what side effects you should know about, and why your doctor may choose one over another. Because after 60, your body changes. Your kidneys may process medications differently. Your blood vessels become less flexible. You may be taking several medications at the same time, and you may become more sensitive to blood pressure dropping too low. So the question isn't simply, which pill lowers blood pressure? The better question is, which treatment makes sense for my body and my health situation? Before we get into the 3 medications, tell me in the comments which one you take: amlodipine, losartan, or lisinopril. I would love to know how many people watching this are taking each one. Now let's start with amlodipine. Amlodipine belongs to a group of medications called calcium channel blockers. Its job is to help relax your blood vessels. Think about your arteries like flexible tubes carrying blood throughout your body. When those vessels are too tight, your heart has to push harder to move blood through them. Amlodipine helps relax those vessels, making it easier for blood to flow and helping bring your blood pressure down. And for many people, it can be an effective medication. But there is one side effect that many people don't immediately connect to their blood pressure pill: swollen ankles. You may notice that your shoes suddenly feel tighter. You may look down at the end of the day and notice that your ankles or lower legs look puffy. And you might think, well, I'm getting older. But if you're taking amlodipine, it's worth mentioning that swelling to your healthcare professional. It doesn't automatically mean the medication is dangerous. And it certainly doesn't mean you should stop taking it yourself. It simply means your doctor or pharmacist should know what's happening. They can determine whether the swelling is related to the medication, whether something else could be causing it, and whether your treatment needs to be adjusted. There's another symptom you shouldn't simply dismiss as getting older: dizziness when you stand up. Imagine sitting in your favorite chair for a while. You get up, and suddenly you feel lightheaded. Maybe you need to grab the table. Maybe your vision briefly feels strange. Or perhaps you feel like you need to sit back down. Repeated episodes like this deserve attention. Blood pressure that becomes too low can contribute to dizziness and falls can be particularly serious as we age. So don't simply say, that's just part of being over 60. Write down when it happens. Check your blood pressure according to your healthcare professional's instructions, and let them know. Now let's move to losartan. Losartan belongs to a medication group called ARBZ. That stands for angiotensin II receptor blockers. And to understand why losartan works, you need to understand one of the systems your body uses to regulate blood pressure. Your body produces a substance called angiotensin II. One of its effects is to tell blood vessels to tighten. When those blood vessels tighten, blood pressure can rise. Losartan blocks the receptor that angiotensin II normally acts on. That allows the blood vessels to remain more relaxed and helps lower blood pressure. So even though losartan and amlodipine both lower blood pressure, they're doing it through completely different mechanisms. And that brings us to something very important. Losartan can affect potassium levels and kidney function in certain people. This is one reason your healthcare professional may order blood tests when you're taking this type of medication, particularly when starting treatment, changing the dose, or if you have certain kidney or other health concerns. And this is something I really want seniors to understand. A medication can be doing its job perfectly and still require monitoring. You don't always have to feel something wrong for something to deserve checking. Sometimes the important information comes from a blood test. And this is also why you shouldn't start taking potassium supplements just because you heard that potassium is good for blood pressure. Potassium is important, but more isn't always better. Your kidney function, medications, and overall health determine what's appropriate for you. Now, if you're finding this information useful, take a second and tell me in the comments. Have you ever been surprised by a side effect from a medication you were taking? Because sometimes the symptoms we dismiss as normal aging are actually worth discussing with our healthcare professional. Now let's talk about Lisinopril. Lisinopril belongs to another medication group called ACE inhibitors. ACE stands for angiotensin-converting enzyme. Lisinopril works by blocking an enzyme involved in the production of angiotensin II. Remember what we just talked about? Angiotensin II can cause blood vessels to tighten. So when that pathway is blocked, blood vessels can stay more relaxed, helping lower your blood pressure. Lisinopril is a commonly used blood pressure medication, and for many people it can be an excellent choice. But there is one side effect that gets a lot of attention: a persistent dry cough. Not a cough because you caught a cold, not necessarily a cough from allergies. I'm talking about a nagging, dry cough that seems to keep coming back. You may find yourself clearing your throat constantly. You may notice it more at night. And you may wonder why you suddenly develop this cough when you otherwise feel fine. If you're taking Lisinopril and you've developed a persistent cough, tell your doctor or pharmacist. Don't stop the medication on your own. Your healthcare professional can determine whether the medication could be contributing and whether another treatment might be more appropriate. And just like Losartan, ACE inhibitors can also affect kidney function and potassium levels in some people. That's why monitoring can be important. Now here's where many people make a mistake. They hear all of this and immediately ask, so which one is the best? Is it Amlodipine? Is it Losartan? Or is it Lisinopril? And here's the truth. There isn't one medication that is automatically the best for every senior. Your body is different from your neighbor's body. Your medical history is different. Your kidneys may work differently. Your other medications may be different. You may have diabetes. You may have heart disease. You may have experienced certain side effects before. And all of these things can influence the medication your healthcare professional chooses. That's why I don't want you thinking of these 3 medications as a competition. It's not about finding the strongest pill. It's about finding a treatment plan that controls your blood pressure while making sense for your individual health needs. And sometimes that treatment plan includes more than one medication. In fact, many people with high blood pressure need a combination of medications because different medications work through different pathways. So if your doctor has prescribed 2 medications, don't automatically assume something has gone terribly wrong. It may simply mean your healthcare team is using different tools to control your blood pressure. But there's another part of this conversation that I don't want you to overlook. Your blood pressure medication is only one part of the bigger picture. What you eat matters. How active you are matters. How much sodium you consume matters. Your sleep matters. Your weight, when appropriate, matters. Your stress levels can matter. And keeping your medical appointments matters. The goal isn't simply to take a pill and forget about your blood pressure until your next prescription refill. The goal is to create a complete plan that helps protect your heart, brain, kidneys, and blood vessels over the long term. And that brings us to 4 questions I want you to consider asking at your next medication review. The first is, why was this particular blood pressure medication chosen for me? That's a very reasonable question. You deserve to understand your treatment. The second question is, what side effects should I watch for? Don't wait until something becomes severe before asking. The third is, do I need to have my kidney function or potassium checked? Your healthcare professional can tell you whether monitoring is appropriate for your particular medication and health situation. And the fourth question is, what should my personal blood pressure target be? Because your goal isn't necessarily identical to your neighbor's. Your healthcare professional can determine the blood pressure target that's appropriate for you. And please remember something very important. If your blood pressure reading looks normal, that does not automatically mean you no longer need your medication. Sometimes the reason the number is normal is because your medication is working, so don't stop taking it because you had one good reading. If you're experiencing side effects, unusually low readings, dizziness, or other concerns, speak with your healthcare professional. Your treatment can be reviewed. Your medication can potentially be adjusted, but it should be done safely. So let's bring everything together. Amlodipine helps relax blood vessels by blocking calcium channels. Losartan blocks the action of angiotensin II at its receptor. Lisinopril blocks an enzyme involved in producing angiotensin II. 3 medications, 3 different mechanisms, and 3 medications that may be appropriate for different people depending on their health circumstances. Amlodipine can be associated with ankle swelling. Losartan can affect potassium and kidney function in some people. Lisinopril can cause a persistent dry cough in some people and can also affect potassium and kidney function. But none of these facts means you should stop your medication. The lesson is much simpler. Know what you're taking. Know why you're taking it. Know what symptoms to report. Know what monitoring you need. And have an open conversation with your healthcare professional. Because getting older doesn't mean you should simply accept every uncomfortable symptom as normal. If something has changed since you started your medication, speak up. If your ankles are suddenly swelling, if you're constantly dizzy when you stand, mention it. If you're dealing with a persistent dry cough while taking lisinopril, mention it. And if you're unsure whether your current medication is still the right fit, ask. You are not bothering your doctor by asking questions about a medication you take every day. You're participating in your own health care, and that's important. So before you leave, look at your medication bottle, find the name, look at the dose, and think about how you've been feeling since you started taking it. Then, at your next appointment, bring those observations with you. And if you're taking amlodipine, losartan, or lisinopril, tell me which one you're taking in the comments. I read your comments, and your answers can help us decide which medication topic to explain next. Most importantly, never stop or change a prescription blood pressure medication on your own. The goal isn't simply to lower a number. The goal is to control your blood pressure safely while protecting your heart, brain, kidneys, and blood vessels for the years ahead. And the more you understand about your medication, the better prepared you are to have that conversation with the healthcare professional managing your care.